It's time for a Wellness Revolution. Brought to you by Hotze Health and Wellness Center. Honest discussion on maintaining health and wellness naturally to enjoy a better quality of life.
He's the doctor fighting to let you keep your doctorate.
Now, Dr. Stephen Hotze. Dr. Hotze's Wellness Revolution podcast is brought to you by Physicians Preference Pharmacy, formerly Hotze Pharmacy.
Welcome to Dr. Hotze's Wellness Revolution. I'm Stacey Banfield here with Dr. Stephen Hotze, founder of the Hotze Health and Wellness Center. So glad to have you with us today. We have back on the program Dr. Mila McManus. We were visiting with her on another subject, stem cells, which you can always check out on one of our other podcasts. You can always look that up online at hotzepodcast.com. That's HOTZE podcast.com. But today we have her back on the program to talk about something I'm not quite sure what it is. It's energy medicine, and that could be a lot of different things. So I'm curious to hear what she has to say on that topic. Dr. Hotze.
Thank you so very much, Stacey, and thank each one of you for joining us today on Dr. Hotze's Wellness Revolution. Yeah, we're leading a wellness revolution. It's going to change the way men and women are treated as they mature through natural approaches to health. I believe everybody needs a physician and a staff of professionals who can coach them. They have the wherewithal and know-how to coach you on a path of health and wellness naturally. So as you mature, you've got energy, you have vitality, and you've got enthusiasm for life without taking pharmaceutical drugs. Remember, pharmaceutical drugs are toxins. And if you take pharmaceutical drugs and you're sick and you take those, you're going to get sicker quicker. So we want to do everything we can to promote natural approaches to health. And that's why I've invited onto our program today Dr. Mila McManus. Dr. Mila McManus, a graduate of the University of Texas in 1996. She graduated from the University of Texas Medical School in Houston in 2000, did a family practice internship and residency at St. Joseph's Hospital, board certified in family medicine, and she's also board certified with the American Academy of Anti-Aging Medicine. So Dr. McManus, I've been to your wonderful office. And by the way, Dr. McManus, I met her about 15 years ago when I trained her and about 18 other physicians in natural approaches to health and my medical and business protocols, which she just took and ran with. She's got a marvelous practice, the Woodlands Institute for Health and Wellness in the Woodlands, Texas. And I've been to her office. It's a wonderful office. She's treated thousands and thousands of individuals and helped them get on a path to health and wellness naturally. And she's has some new modalities, some new treatments and therapies that she uses in her office. And one is called Pulse Electromagnetic Field. And so tell us about PEMF, electromagnetic fields. We've always thought electromagnetic fields are dangerous. Tell us about the machine you use and how you use it and what you treat with it.
So the machine that we specifically have, a brand is called Ondamed, and it's been around for 25 years all over the world. It's only been FDA approved in the United States for about the past 10 years, but it's only FDA approved as a biofeedback machine here for whatever reason. So, we have to give the FDA disclaimer to patients that it does not diagnose, treat, or cure anything. But outside this country, it's doing a lot. So
outside the country, it's treating a lot and curing a lot, right? Good.
Yeah. So PEMF is nothing new. It's a spectacular type of technology, and there are a lot of different PEMF machines out there. But what makes Ondamed superior is, in my opinion, is the biofeedback part of it, where we can hook the patient up, so to speak, and scan through thousands of specific frequencies that the body can react to and respond to in a good way, that promotes healing in the body, no matter what the problem is. So the EMF that's dangerous for people, such as what we're getting from our laptops and cell phones and the Wi-Fis that are in our houses and buildings, those are scattered type of EMF signals, higher frequencies. PEMF is very focused energy or very low frequencies. They're healing frequencies. So while it's all on the spectrum, the electromagnetic spectrum includes visible light, radios, microwaves, X-rays, etc. So there's benign frequencies and there's dangerous frequencies along that spectrum. So what we use it for is pretty much anything and everything, because we can't say it's treating anything in particular. What it's doing is jump-starting the body's ability to heal itself. And so the cells in our bodies communicate in different ways. And so one that many people are aware of are chemical messengers. So that's a type of signal where there's some kind of chemical produced by one cell that talks to another cell, or when you take a prescription drug, that's a chemical messenger doing something within the body. But another way that our cells communicate with one another is with electromagnetic signals, which are these specific frequencies along the electromagnetic spectrum. So the example I give is, if you are in a parking lot and you're clicking on your remote to unlock your car door, it doesn't unlock everybody's car door. It only unlocks your car's doors, and that's because it's speaking a specific frequency to your car only. So similarly, these frequencies your body responds to, and that we find through the biofeedback, and then we can apply those frequencies to jumpstart healing processes in the body. We can also use it's called a hand applicator. I call it a wand. And we can scan the body from head to toe, and with the biofeedback, find areas that are dysfunctional where we want to apply those frequencies specifically. And so I can give you just countless testimonials of what we've seen this machine do over the years that we've had it. And one of my favorite is because it's my first, and it's my mother-in-law story. And she's had chemotherapy for cancer back in 2001, and since then she had neuropathy from the chemo, and it had just been getting progressively worse over the years. And when you get neuropathy from chemo, it's deemed to be a permanent problem. And it's in her feet, and she was having trouble just sleeping at night. She'd have to get up and walk around. She couldn't have the sheets touching her feet. It was painful. And she started Ondamed, and we did 6 sessions on her, and her neuropathy completely disappeared miraculously. But we can't say it was the Ondamed because the FDA won't let us say that. So.
Well, that's an interesting story. You've been using Ondamed on this electromagnetic field pulsing for how long?
Oh, I think it's probably been about 4 years, possibly 5. I lose track. But it's pretty amazing.
So what are some of the other conditions people come in for which you try to help them and correct their frequency so their body can heal itself?
Oh, headaches and migraines, acute pain, chronic pain, wounds that aren't healing. So if somebody has poor circulation, for example, we had a woman who's been a smoker her whole life, and she had a biopsy near her ankle, and it wasn't healing, and they skin grafted it, and the skin graft didn't work because she had such poor circulation. And so she came in for some Ondamed. I believe she only had about 3 sessions, and it began to heal quite nicely.
Now,
when you use
the wand, and which is putting out low frequency electromagnetic energy, when it puts out, do you treat the air? Like, for instance, somebody has headaches. Are you using the wand in their head, or may there be other areas of the body that are dysfunctional that you can correct the frequency, and it solves a headache problem, like a meridian? When I think about people that use acupuncture.
Yes, that's a great question. So there's something we call the main complaint, which would be headache or my shoulder hurts, and then there's the main focus. So the main complaint would be you apply the energy right on their head or right on their shoulder area, but you can't really just do that, because what you find is you sometimes have to find the main focus, which is a technique that we use to find which area of the body is most dysfunctional that's pulling energy away from other parts of the body, causing them to just degenerate and wear and tear. And so we find the main focus and we treat the main focus, and it allows the main complaint area to heal. So I've treated, just for example, a patient who had 7 or 8 years of pain and a piriformis issue kind of on the bottom of her buttock. And we were treating the main complaint area, and we got her chronic pain from perhaps a 7 to 8 out of 10 down to a 2 out of 10. And she was ecstatic about that because she's lived with this pain for so long. But I wasn't satisfied with that. So we did the exercise to find her main focus, which happened to be her right pelvis area, whereas her main complaint area was her left buttock. And we did one session on the right pelvic area, and it resolved her pain. So that's a good example.
This is fascinating, and I presume it's something I mentioned about acupuncture. It's something along those lines. It must be, that we must have these energy meridians, I guess, in our body. And I'm not an expert and don't know much about acupuncture, although I've seen some amazing videos about what people have done with acupuncture, know people that have benefited from it. So anyway, this is a very fascinating therapy that you offer. Now, if an individual would like to visit with you about chronic conditions they have to see if they might be able to be helped correct that situation using your energy machine, which is, tell me the name again, it's called?
Ondamed.
Ondamed.
Latin for wave medicine.
Wave medicine, okay. So what we're doing is putting out energy waves and trying to let the body correct and heal itself. So if someone wants to call you and come out for a session, what number and how do they reach you?
Yeah, they're welcome to call our office at 281-298-6742, or they can visit our website at twihw.com, which is the initials for the Woodlands Institute for Health and Wellness. And if I may just give a quick bullet point list of what this does, it increases circulation, oxygenation, detoxification, it decreases pain, swelling, inflammation, and it's non-invasive.
Which is great. And it has nothing to do with putting any toxins in your body.
Right.
That's so good.
All right.
Great. And tell us your phone number again, Dr. McManus.
281-298-6742.
Well, I want to thank you for this very informative podcast and helping explain this new modality of energy medicine. Thank you so much for joining us today.
Yes,
Mila.
thank you, Dr. McManus. Fascinating information.
Thank you for having me.
And it's all about putting the body back into balance, and that's just another way to do it. And if you want to find out more about what we do here at our center, you can always call us at 281-698-8698. That's 281-698-8698, or you can continue to download our podcast and get more information at hotzepodcast.com. We're so glad you joined us today. Thank you again. And we're just signing off here at Dr. Hotze's Wellness Revolution.
A special thanks to Physicians Preference Pharmacy, formerly Hotze Pharmacy, proud sponsor of Dr. Hotze's Wellness Revolution podcast.
Information provided on this radio program is neither intended nor implied to be a substitute for professional medical advice and is not intended to replace the services of a physician, nor does it constitute a doctor-patient relationship. You should not use information from this radio program to diagnose or treat a health problem or disease without consulting with a qualified healthcare provider. If you have or suspect you have an urgent medical problem, promptly contact a professional healthcare provider or call 911. Dr. Hotze's Wellness Revolution radio program advises you to always seek the advice of a physician or other qualified health provider prior to starting any new treatment or with any questions you may have regarding a medical condition. Any application of the recommendations from this radio program is at the listener's discretion.